Okay, hello everybody. With this pleasant surprise of seeing a lot of people as panelists, it's good to see everybody. My name is Yair, and welcome to the webinar series. And today we're going to do something. Hold on.
Right, I'll figure it out. David, just turn your camera off.
Yeah. Okay, so this is a series of webinars, and as you know, we have basically invited many speakers from Israel, over 35 Zoom webinars from Israel, from the United States. But what we're going to do here today is something a little bit different. We're very lucky to have, and Yael is going to present our two panelists. And this is going to be more of a practical Zoom webinar on how to fight anti-Semitism in organizations, with more specifically in healthcare organizations. So I wanted to introduce myself. I'm Yair, and I belong to two organizations, the Hope for Israel Alliance, which is basically an organization that has people from all over the world, Australia, most of the countries in Europe, Canada, United States. And really what we do in this organization is supporting Israel and fighting anti-Semitism in any way, in any arena that we can. So that's the Hope for Israel. But I also belong to the American Jewish Medical Association, the AJMA. And I'm lucky to have, as a co-moderator for today, Yael Halas, who I've had the fortune and the luck to work with her multiple times on different webinars and in person here in Philadelphia. She is the founder and the president of the AJMA. And, she's going to tell you a little bit about the organization, but she started it at the beginning of the war when she just had a WhatsApp group, and more people, healthcare providers joined. It exploded to hundreds of people, and she thought that something needs to be done. And until today, I think that she is one of the most impressive people that I've ever met in my life. And she's doing so much, except maybe sleep, that she doesn't do much. And so that's kind of the introduction to Yael. She's also a plastic surgeon running a very busy clinic on, that's her main job, and has a family. So really an incredible person. And thank you for being here. I'll just remind everybody that this is a webinar for 60 minutes up to 75 minutes. And usually these webinars, because of questions and interest from the audience, will last 75 minutes. So we have a hard stop at 9:15 Eastern time. The last thing that I'll remember before I turn it to Yael is that, please, all of you, this is an open session. We want to hear you. We want to hear your questions. This is why Mark and Elise are here. So feel free to post your questions to the Q&A below. Okay, Yael.
Hi, everyone. So I'm also super glad that we're recording this evening, because what we're going to be talking about today is really a game plan for many of us to bring the disturbing thoughts and frustrations and fears that we've had from this entire year and put them in a way that is going to be actionable and really make change. And thank you, Yair, for the wonderful introduction. But I think I pale in comparison to my wonderful colleagues who are on the panel tonight, and honestly, who all make up part of what has become the American Jewish Medical Association. We are all incredible, talented physicians, but also everything from social workers, nurses, all branches of healthcare, administrators, who just are incredibly concerned and have taken on the fight for stopping the hatred of Jewish people, and also pride in who the Jewish people are, as the second jobs they never knew they never wanted. My fellow warriors on the panel tonight, first I'm going to introduce Dr. Mark Poznanski, who is a truly incredibly esteemed physician and researcher. He is trained from Cambridge. And I'm sorry, I do have to do a shout out, because I am a huge Anglophile, and it is impressive that you got both of your degrees at Cambridge. And then Harvard came calling to steal you from the UK, from the Imperial College. And I don't want to take away from your story, because when we spoke many months ago about everything that was going on at Harvard and all you were doing to mobilize, you have some incredibly compelling stories about how you have had to deal with anti-Semitism starting in the UK. And what we've been seeing here in the United States is that what has happened in the UK, we're following along in what's happening here in the US. literally for both Mark and Elise, their CVs go on for pages and pages, because Mark also runs the virus center at and founded it at Harvard. I am going to throw out there that you discovered Fugitaxis, because I think that is particularly great. But he is, I mean, just one of the most esteemed at one of the most esteemed institutions. And the same also can be said for Elise Park, who is a couple of things about Elise. And I think when you know her background, it will describe how she is as a person so much now. She is incredibly well educated as well, has her PhD in psychology, but also did some of her academic training in Israel as well. Having an appointment in both the Department of Psychiatry and Medicine, I think all of these perspectives really help create who she is, which is an incredible author and a compassionate person as well. So I'm going to stop talking because both of you have an incredible tale on how you came to be, where you are in life, and what actions concretely can be done by everyone in the audience in finding the power, cohesiveness, and community in a very active and effective way. Mark.
Well, firstly, thank you very much for that very kind introduction. And I really feel very privileged to be able to speak to the AJMA and to you and Yaya about the experiences that we've had, or that I've had, that brought me to this place, today on October the 15th, 2024. I just give you a little bit of an arc, because I think that's important. Growing up in London in the 1960s and 70s, it was very apparent to Jewish kids in London that there was anti-Semitism from the first day in a playground at the equivalent of, as about 7 or 8 years old, when a little girl came up to me in the playground and said, "You murdered Christ." And I remember the thought went through my head at that point was, I don't actually know who Christ is. I don't, that didn't ring a bell. And I was actually quite a fearful little child growing up. And the idea that I might have murdered someone was sort of rattled into my brain until I went home and said, someone just accused me of murdering someone. And my parents had to explain what that was about. And even then, that was a mystery. However, by the time I got to high school, where I went to a very good high school, it would have been the equivalent set up to like Hogwarts, but for non-magicians. And the truth was that there was, endemic anti-Semitism there too, which was completely normalized to the point where whether you're called a murderer of Christ or not, that was just, that was just part of being at the school. And there was fighting that went on between the boys. It was an all-boys school. And until my older brother, fortunately, I was there with my two brothers, one older, one younger, and my older brother decided to organize the Jewish boys that represented 10% of the boys. That's 120 boys out of a school of 1,200 boys, aged from 9 years old to 18, and organized them into a Jewish group that would be able to meet on the mornings when we were normally forced to stand at the back of the Christian assembly. And so he organized us, so we were able to do that. Ultimately, I took over that organization, my younger brother, and then it went on down the line. But we basically asserted ourselves as we are Jewish boys and we have our own organization. And anti-Semitism declined incredibly to the point where I can say I ended my years at high school, having started there at the age of 9, really not witnessing a great deal of it. There was still sporadic stuff, but the Jewish boys would stand up for it and go to the headmaster and say, this boy was threatened with that, this Jewish boy was threatened with that, and generally also deal with it ourselves between us. So I just want to set that up. I don't want to take all of the time here, but just to say that it was sort of pivotal experience when these sort of things started to arise, actually before October the 7th, with the Boston Mapping Project and a website by BDS, which declared that their goal was to eliminate the Zionist and other settler colonial conspiracies in the Northeast, to eliminate them, and had created an enormous list of Jewish organizations, people by name, by address, that were part of this process called the Boston Mapping Project. Politicians came out immediately, said this is horribly anti-Semitic. And interestingly, my son, at the age of 7, whatever he was at that time, 14 or 15, said, "Dad, do you realize you're named on this list?" And when I found the reference to it, was because I do vaccine development for viral infections, and part of my funding is from the Department of Defense, and they took a great offense to the fact that the Department of Defense here in the US is committed to developing fast, effective vaccines to prevent infectious diseases. But nevertheless, that was my impetus to start the essentially a organization of Jewish healthcare workers to address this type of situation. So that brings us to probably about 18 months ago. So I'll just leave it at that and hand over to Elise. Oh, you're on mute, Elise.
I'm on mute. Thank you. So I'm going to keep it very brief, my background, and then I'll tell you how I met Mark. So I was raised in a rural town in Connecticut, also faced a lot of anti-Semitism. Similarly, we seem to have playground stories. When I was in 3rd grade, I remember being in line at recess and we were lining up. We were supposed to be quiet, and the boy in front of me told me I was going to go to hell because I didn't believe in Christ. And I was getting in trouble for talking, and I said to the teacher, but he said I'm going to burn in hell, and I still got a detention. And that was kind of when I started, kind of my eyes were opening up. And just, we grew up in a very small town with a nice small temple, but there was a lot of anti-Semitism. So I kind of was raised always having my kind of feelers out for it. Was very familiar with it when I went to college. I remember meeting friends from areas that grew up that were predominantly Jewish or more Jewish, and really understanding that I had a different experience growing up. I have been at Mass General for 20 years, and I, on October, I think the October 7th was a Saturday last year, right? In October, I believe it was still a 3-day weekend, and both of my children, I have a teenage son who is in Israel this year. He's on a Air Force right now in Tel Aviv, and my daughter who's applying to colleges this year. And my daughter, they're both in Israel this summer, came back like in July, and on October 8th, she came down. She had been watching videos with some of her friends of Shani Luke and saw some of the clear signs of the gender-based violence. And she said, "Mom, this could have been me." And she was holding the phone, and I just realized I needed to do something. And that's actually what catalyzed me. We have a lot of friends and family in Israel. And I think I'm the only Jewish woman who's professor in both medicine and psychiatry at Mass General in the system at Harvard Medical. So I started emailing some of the leaders asking, was something going to be sent out? This was something. We have friends we have several friends who lost family members, and on October 7th, and I felt that I was surprised that the institution that usually speaks up against high-profile hate crimes hadn't said anything, and that's how I got. And so they did send out something, but the head of medicine, Jose Flores, also then connected Mark and me, and that's how we started.
Yeah, I was just going to add one kind of intriguing story, which I think may help people in the audience hear about this, why we as Jews have to act and organize, is because unlike a lot of situations, when I reported to Mass General the BDS issue to security, saying that I'd been named and I was concerned, they said, "Well, we've informed the FBI and you should probably get security on your home, and if you have to go to your car late at night, please feel free to get security to take you to the car." And I was thinking, wait a sec, I'm at Mass General Hospital, this is 2022, and that's what you're going to do for me, is get me, you know. So I reported it and basically came to the conclusion, I was being told, well, if you want to do something about it, please feel free to do it. We have this structure called employee resource groups. If you'd like to put one together, you know, think about that type of thing. And so it was put remarkably, but you know, given my character, if someone says that to me, I'm like, okay, I'll do it. You know, but I was surprised that the response was, well, you go off and do something to help the Jewish community at your hospital if you're concerned about it, even though I'd been told that this was being taken seriously at the very highest level. So that's the picture from my perspective I want to paint, which is that we actually have to do it ourselves. We have to find the allies that we can, but we actually have to do it ourselves. And even though it can be irksome to say, well, why isn't someone else doing it for us? We actually need to do this ourselves. And we hope that by putting the employee resource group together here, we're able to create, through this type of online session, a roadmap for others who go, yeah, nothing's happening here. We have to organize and do something. That impetus is very powerful, and it's actually very liberating when you grab that with both hands and go, okay, we're going to run with this. And probably sometimes to the surprise of the other person on the other side of the table, that you are actually willing to do that. But I'm very encouraging of that now. And I found an amazing partner in Elise, who feels exactly the same way. You know, there's a job to be done. We're going to do it, you know.
So this is an amazing introduction.
Go ahead, Jen. I was just going to
Go ahead,
go
please.
ahead, Jen. I was just going to say the institution has been supportive, but it has been one of those build it and they will come. Mark and I did not know each other beforehand. We balance each other well. We're very appreciative of each other. I think having a physician and a psychologist is helpful, but I think it has been, I think the first thing we were doing is trying to kind of establish what the community needed. And I think a lot of healthcare professionals I speak on behalf felt a lot of betrayal about kind of our life commitment to helping others and just feeling quite lost those first couple weeks. And that's really, as we came together, the institution was pretty much said, just, we had the blessing of the heads of psychiatry and medicine, but no one really told us what to do. And we're still moving along with the community needs. And as we expand, I just want to say there was no kind of roadmap, or Mark and I would just meet. And really it came to us because people would come to us, whether it was needing support or with specific issues. Done a lot of advocacy work within the Harvard University, as you can imagine, and within the system. So really, and it's continued to grow. We have a wonderful group with several of them are on now. We keep building across the hospital system of people from the different hospitals. We're now across a hospital system. It used to be Mass General, and now we've built, and we have members from each hospital. So I want to encourage people who are starting to do this, like to just continue to build and to go with it and to find strong partners, because that was what we did. It was very organic, and as we continue to build and grow, the needs continue.
So this is really fascinating introductions and your personal stories. But let me pause for 1 second, because why am I pausing? Is because I remember that I have spoken now with Mark, I think 3 times or 4 times by now. And before the first conversation, I didn't really know what Employee Resource Group, or ERG, is. You know, I work in an academic facility. It's partially university, partially a hospital. I didn't really know what it means. What's the significance? Is it sponsored by the university or the hospital? So I think that the roadmap for this next 50 minutes or so should be the following. And we may need a second session for this, because this is super important. First of all, I would like to learn, and we would like to learn from you, what is really an ERG? If you can tell us, what is an employee resource group? As you're telling us about this, people will have questions. Some of them already, some people already texted me or Yael about questions. For example, somebody from California said, well, we were told that we cannot form an ERG, a Jewish ERG, because it can't go by religion. So I'm sure there's going to be a lot of different questions. But I would also, after you speak about ERGs and what you did at Mass General Brigham, we would also, towards the end of the session, or maybe in the next session, we would like also kind of like a toolkit. Okay, so you explain to us what an employee resource group is. How do we do it? I work at Jefferson. You know, people work here in Philadelphia at Penn, Temple, Mainland Health, etc. What should be our next steps? So with that, maybe Elise or Mark, tell us about an employee resource group.
I want to talk about the first steps we made. I mean, which is, maybe it was easier here than in California because we were told that that was a mechanism that staff had to organize community-led groups. There was a Hispanic ERG, African-American ERG, LGBTQ ERG that already existed. And we were told that we would fit in that model of an ERG. And I just want to make sure that's clear. So ERGs, you can go online and search it. There's a sort of template. We're here to support community. We're here to support networking. We're here to support our own work. In other words, you know, if doctors or healthcare workers, physicians assistants, radiotherapists who are Jewish are having work-related issues associated with their identity within the ERG, our network of the ERG is there to support them. So you can see how it essentially, in some ways, replaces management having to worry about doing anything, because in a way it's saying, well, those groups who are having issues working in the hospital will work these things out between themselves within that organization, and we will give them the permission to do that. They're also, you know, I can't work on putting these things in the chat. There are documents that are associated with ERGs. There are legal agreements about things that we can do and what we can't do. We can't organize unionization. We can't do various sort of more political sort of arrangements. But we can work within our healthcare worker group to do these issues, supporting community, and that includes a celebration of religious events. And we've done several of these in the chapels of the various different hospitals that we work within. Cultural events, we've done various different celebrations, which are really ethnic in some ways more than religious. And I think Elise will probably talk to some of the more subtle aspects of Judaism that relate to ethnicity, race, religion, culture, all of these sort of things that make this argument that, you know, the Jewish ERG is only a religious organization really not appropriate, because the diversity of Jews is such, and I've spent a lot of time trying to educate my colleagues on this, is extremely diverse. I have LGBTQ members in my family. I have African-American Jewish members of my family, Asian American Jewish members of my family, Eastern European and North African members of the Poznansky family. So the idea that somehow this would ever fit comfortably in a religious ERG is just not, it doesn't fit for Judaism. I don't know, Elise, you have... Yeah.
So Mark's idea was to establish a formal employee resource group, and on our institution that falls under DEI. We were the first faith-based group. This was Mark's idea. And we also were expressive that we would help them set up a Muslim ERG. We've offered to help. And since then, there's been a Catholic ERG. So really this concept of faith-based ERGs is really growing. And I put a chat, put for me a chat in the article, an article in the chat where I had been trying to get an op-ed published about the gender-based violence on October 7th. And I reached out to New York Times reporter who said, I can't, that's not my area, but tell me about the ERG. And so she talks in that article, I think it's informative about how these employee resource groups previously hadn't included religious-based groups. So we've also, the other important thing about this is we're not political, and I think that's important. Mark talks about how diverse we are, and we often we started with listening sessions every week. We've conducted 2 surveys in which we reported to the leadership in the hospital that Jewish employees don't feel safe. So we really took it upon ourselves to to start this group as we were building the formal employee resource group rubric. I would say at a lot of the events, a lot of the listening sessions, we've had events. There is a poll for politics, so we really stay out of that. We can share, I can put our mission statement, yeah, if you want, I can send it to you to put it in the chat. And we're very clear that we are for people who identify as Jewish or affiliate with Jewish communities so that it's inclusive. And we spend a lot of time working on that. So it's basically, Yair, a place where we, people who share the same healthcare worker identity can gather together, not to fulfill religious aspects that they feel outside or other religious or political communities, but to share their identity as someone in the healthcare system who's Jewish at this time.
Yeah, and with all Jewish identities are obviously accepted. So, we had a remembrance event in the MGH Chapel and the Brigham Women's Chapel, supervised by a chaplaincy rabbi, which was prayers and songs to do with we and those people who wanted, those members, and actually these things have to be open to everybody. We can't stipulate it's just for the Jewish ERG, which is quite right. People could attend that, but that's voluntary. People could go to that if they wanted to or not. And then we had a listening and support session that evening or 2 evenings later where people could just join and just discuss their concerns, feelings about October the 7th memorialization. So just to give you a hint of the sort of range of things that we sort of imaginatively put together that steer a careful line away from politics and follow as closely the diversity of Jewish identity as possible, basically.
Amazing. And one of the key things that you said is the first step and one of the first tasks was just to form a sense of community and to have listening sessions, because that as we saw with forming the AJMA, and which started with a bunch of WhatsApp chats, is and every time I talk to somebody, everybody is so shocked by the anti-Semitism in medicine that that's really one of the most helpful first things to do. Also, and just in terms of, just to make it crystal clear for people and why the importance of having an ERG is, this gives you access to formally promote things on the university or hospital listservs. So you can actually send email blasts out. This allows you to hold speaker events, to be able to have a room, to also publicize things throughout the hospital and post things. And one of the things that we've been seeing so much is that there are so many kind of illegal events going on. And this gives a very legal way for us to unite and to publicize and to hold events. It's what we're seeing a lot. There's a lot of questions in the chat, and we're seeing a lot everywhere, is that so many institutions are resistant to forming a Jewish ERG. And Elise, you put in the New York Times article saying that they're opening to faith-based. And also it's a lot of the question and answers that are going around is that the point with the Jewish ERGs is that we are not just a faith-based. We are also a heritage group. And exactly as you're saying, Mark, we may be of all colors, of all stripes, of all political spectrums, but it is a ethno-heritage group as well. And under that rubric, we are allowed to be part, even when faith-based traditionally have not been formed, we still do form. And another thing that I would very much point out is that if you read the May 2023, well before October 7th, White House strategy to combat anti-Semitism, it flat out says that the DEI offices are supposed to be fighting anti-Semitism and allowing for Jewish ERG.
Right.
And, and for those who want a sample letter or resources, the AJMA actually has now produced a local guidebook on the first step for Jewish ERGs. You mentioned in this, and we were talking about this before, that they're inclusive and open to everyone, the same with the American Jewish Medical Association. There have been, as we know, there's Jewish Voices for Peace. There is the wonderful thing about being Jewish is really our Talmudic heritage. We will answer questions, we will ask questions, then we will re-ask the question and debate it from every single perspective. So what have you encountered people in your group who are very opposed to completely on the other side of the spectrum? How are you managing the differences?
Well, I'll start just by saying that the whole thing is voluntary, and you have to have some sort of centering to any organization. And given that much of this was driven by the horrors that occurred on October the 7th, the central component is Judaism of whatever sort of stripe or color you're talking about, which is a voluntary, we have Orthodox members and liberal members and all the rest of it, but also that we follow the IRA definition, and that was made clear when we sent around our questionnaires about the experience of anti-Semitism, our surveys. We included the IRA definition as one of our focal points is that demonization, criminalization of Jews or of the state of Israel is a form of anti-Semitism. We had to, it seemed to me, declare a centering point about anti-Semitism, because that was the issue we're dealing with. It's a bit like if you came to a hospital and you had sepsis and you said, well, we really centered on homeopathy, or we're really centered on holistic approaches to treating sepsis. That if you come here, that's our central thing, acupuncture, homeopathy, whatever. And you'll be thinking, well, maybe that will work, but I'm opting for one that has an ICU and antibiotics. And I think given that when we were doing our listening and support sessions to begin with in early November, the problems that people were talking about were so severe, and I want to tell you, and probably others on this call would relate to this, the listening support sessions we had were some of the most traumatic reports of real mental trauma that people were experiencing at work post October the 7th, that this was not a leitmotif Jewish ERG. Let's celebrate Hanukkah. Let's work out how to do Yom Kippur in an entertaining fashion. This was about dealing with the problems that the community was facing, that we were hearing about in listening and support sessions that were extremely well attended every single week, that were heavy duty trauma related to the experience of anti-Semitism in the healthcare setting and outside the healthcare setting. It's schools, in colleges, parents talking about their experiences. And I just wonder, because that could get lost very easily. It could be like, well, we formed an ERG because it seemed like kind of the cool thing to do because there was sort of this change in the mood of healthcare. No, this was a significant thing, and we reflected that to the leadership of the hospital on regular occasions. We were not setting up an ERG to make hamantash and have latkes at Hanukkah. We were addressing a serious problem, and therefore what we were doing were serious things, and hence the survey, hence the IRA definition of anti-Semitism, because this was not something we could just pass over and make it a light kind of occurrence of creating an ERG. Elise, I know you.
Yeah, I agree. I want to agree with Mark, and then I'm going to get more to, I think, Yael's questions about within the community. I want to say, I think the institution is supportive of us because Mark and I have ended up kind of being doing a lot of work for the institution in terms of supporting the community. And we focus on the fact that we kind of report to them, and people come to us when they feel like there's hostilities in the work environment. So we focus on safety in the work environment and also patient care. And so when we communicate to people how to file complaints. And so we've been kind of the ear of leadership, and many times they've thanked us because we are doing the work that, quite frankly, for a myriad of reasons. Sometimes the leadership can't because of conflicting identities. So when when the 6 hostages were killed, one of them was in our community in Massachusetts, we sent out something to the community. So I think that we've had supportive leadership because we've stayed non-political and because we helped the leadership in many ways. And they will say that during this, they will tout our work because I think they feel and they express appreciation for that. It's not always, it's not always simpatico, but we've always, I think we've developed a nice working relationship with them. Within the Jewish community, we have had people, we now turn off our chat during 2 things that we've done in response. I want to say we've turned off our chat during our listening sessions if it's on Zoom. And every time we have a gathering, whether it's for the Holocaust or October 7th, we get security there ahead of time. And part of that is Jews who are very vociferous, as I know many of you are struggling with within your community. And when someone comes up, if people start to talk about politics, as happened in the chat, when we once had an ADL speaker on a panel and they come out with inflammatory language, I'm very clear. I just repeat, this is not political. This is to support each other in the community. And if you don't feel that this is a community that you can feel supported or be supportive of, that's okay. And we haven't had really any problems since then. I think we've been very overt. You can see the mission statements inclusive. I'm a psychologist. I continue to we repeat the same words to them, and that we are not political. We do not welcome political statements or discussions.
Yeah, and I just want to clarify one point just to be clear. So we had a speaker panel that included someone from the ADL, and it was someone in the chat who started to post, inflammatory, heavily political comments about the involvement of ADL in a discussion about the diversity of the Jewish community. The person from ADL was a member of the LGBTQ community, originally from an Iraqi Jewish family, and it was just, inappropriate inappropriate for the Jewish ERG to have that. I did want to stress another thing, that beyond, and this is hopefully helpful to the participants here, is that beyond Elise and myself, we developed a very much larger leadership group across the hospitals, representing administrative staff, staff that are involved in legal affairs, physician assistants, you name it. We have representative radiologists.
Residents, we're really trying. The trainees are having the hardest time, and so we're trying to really make inroads into the residents.
So one piece of advice is make your leadership group as broad and involving as possible, because you need all of those opinions. We're often bouncing ideas off a lot of people who are actively involved in this, so that we get a very clear, balanced opinion. And then the second thing I want to stress is the clear assertion of allies. And we've mentioned ADL, we've met Project Shema, JCRC, you name it. The other allies that are Jewish organizations that are clearly our allies in all of this, and make no bones about it, we're lucky to have them nationally to keep us advised and to keep the communities safe, but also developing allyships with others. So we do have allies within the hospital, within other ERGs, who, especially at Mass General now, where we're interacting with them, and our events are advertised on their to them as well as within the Jewish ERG. So allyship, I would also recommend very strongly to develop wherever it starts to appear. You want to nurture that, and we gained a lot of allyship from the Jewish organizations initially, but now it's spreading further, and that's a very important thing. We don't want to be an isolated ERG. We want to develop those connections to other ERGs and other organizations that share similar values to what we're doing.
This sounds amazing, and you have done so much in the last year or since you started this ERG. So I want to say something. It's a comment, and it's also connecting to a question that Mark Schwartz, who was one of the best cardiologists I've ever met, asked. The way that I see it is, one of the things, or the most important reasons for a Jewish ERG in the last year is because of the anti-Semitism. I know we kind of talked about it, it's kind of clear, but I want to emphasize this because, for example, in the area of Philadelphia, we have seen so much anti-Semitism on different examples, both personal, micro, or individual. For example, a nurse practitioner or OBGYN who every moment of her free time, she writes on her social media these horrendous lies, really facts, nothing related to the facts. And there was never October 7th, there was never rape, all this. And, you know, people from the institution are trying to fight, they're trying to speak with HR, but they're alone. There's no group to represent them. They're individuals, and they're often being pushed back and nothing is done. But we also see systemic anti-Semitism, for example, a huge healthcare system on their official DEI newsletter monthly. They wrote this most horrible, and some of the people here of this group know the horrible article that they wrote. And as individuals, it's harder, but I think, and from maybe you can, you know, collaborate this, is that if you have a group to back you up, it's easier to fight these incidences of anti-Semitism. Is this what you feel from your experience?
So I'd answer it this way, is that healthcare institutions have a battery of officers that deal with HR, security, presidential matters, legal matters, you name it. And what we've found a path is, yes, we're the ear to these similarly, and we've got examples of them, similarly egregious anti-Semitism in the healthcare setting. But like again, to give a medical analogy, I'm an infectious diseases physician, but if there's a rheumatological problem, I don't try to deal with it myself. I refer the patient to a rheumatologist. So when we have a security issue, we refer it to the head of security. If we, on a listening support session, there's a quasi sort of judicial issue, safety issue, whatever, security and legal. And if it raises to a level of seriousness, we'll put it right up into the C-suite of the hospital system or the hospital president. And so I never feel alone in like, oh my goodness, I've got to work out what Title VI issues are. We've got our allies in the Jewish community organizations like ADL. We've got offices staffed by lots of highly qualified people who actually, once you've reported these issues to them, they have to deal with it. I mean, it's not like they can just go, ooh, I received an email from the Jewish ERG reporting an anti-Semitic text or something like that. We can just ignore it. They can't. We know that. It's just like if you were told a patient had a blood pressure of 80/60, you can't go, well, I don't need to do anything about it. I'll just wait until a cardiologist hears about it or something like that. So hospitals are sort of mandated to act, but we can seek out the organizational structures that will actually professionally deal with the issue that they just can't leave alone in a way. Elise, I know you have thoughts about this too.
Yeah, we also, I want to say, and we're happy, the other thing is we got the data. So I'm a researcher. I developed a brief survey based on an AJC survey on anti-Semitism, and we've administered it twice. And we know that the anti-Semitism is coming not clinician to patient, but is clinician to clinician. It's colleagues, where people, so that helps to get the data, and we've replicated it. We did it in November, and then we did it a couple of months ago, and the data are the same, and we create PowerPoints, and we're happy to share the surveys with people in the PowerPoint format. So we come to them with data. We have a lot of non-successes. We have a lot of those one-offs. Where we keep reporting people who are doing, we think, clinicians who are doing horrifically egregious things, but we keep at it, and we continually encourage people to keep reporting. There's a lot of fear. And so I think the important thing is that Mark and I were both full professors. Some things have happened to us because of this, but we're full professors, and we're like, we can take it. I think the more junior people are fearful, and rightfully so. So I think having senior people kind of stand up is important. And then the other thing is we really, and I think as a group, it would be wonderful if the organization worked. I think, and this is the two things we really need, are clear guidelines in our hospital system about appropriate dress, because there's nothing about religious, interestingly, or political dress. And we've had a lot of, pins and outfits and things that are not appropriate in the clinical setting. And the second thing is the social media, even when it's linked with their professional account. And so I think all hospital systems need clear standards on that about policies and about consequences. And we're working on that, and we work on that often. And we'd love to partner with people who have had any success with that.
Yeah, and I did want to say that the participants online here, we're happy to, well, I would say I'm happy to be on this particular Zoom to answer questions, because I do think this is the moment that we frankly, it's a great benefit to Elise and I, because we do want to, like as academics that we are, clone this and be helpful in cloning this idea elsewhere, and be supportive of organizations that are sort of forming potentially in other healthcare institutions. The problem, interestingly, I think a lot of people hoped it would go away somehow, like most things, it's going to go away. But the truth is it hasn't gone away. We've actually seen a continuous, like our surveys revealed, a sort of a static high percentage of Jewish staff who feel they can't show their authentic identity at work in one way or another. Actually a large majority, and then a minority, around about a quarter, who actually feel unsafe at work. And I don't believe, if we do, I mean, we can think about running the survey again, that much has changed. It's likely to be basically a continuous, almost normalized level. Jews, and I always say some Jews, because I don't, being Jewish, I know not all Jews, but there's a majority of some Jews who come into work not feeling that they can demonstrate their full authentic selves as Jewish or supportive of the state of Israel, or even that they've been to Israel, or even that they work with Israelis, or even if they have any connection to being Jewish. I heard a very sad story just a few days ago. A doctor just said, I've had to just stop wearing my Star of David. I just cannot take it anymore amongst staff. I mean, that type of normalization to eventually just going, well, I don't put my Star of David on at all, and forgetting why I stopped wearing my Star of David demonstrably at work. So I think that also speaks to we're in this very much for the long run. This is not an acute problem. This is now a chronic problem heading towards a level of normalization that we have to keep resisting, because it will be bad primarily for healthcare and our patients, and bad for our institutions and nation if that continues along that path.
So there are so many important points, and the question and answers, by the way, we're up to 17 question and answers, which I'm trying to incorporate in. You guys touched on a lot of points, and I've had to unfortunately spend a lot of time looking into the policies at UCSF, another premier institution which has been unbelievably plagued with anti-Semitism and with staff that have been literally psychologically tortured. And so UCSF actually has quite a robust social media policy and a robust dress code policy. The problem really is enforcement. And by no means, because I'm well aware of all the incidents that have been happening, not only at Harvard's medical institutions, but at their schools of public health and affiliated schools as well. So you guys are by no means in a lucky, enviable position. It's a lot to be done, and a lot of horrible things being done there to fight against. But in some ways you are lucky, because I'm reading all of these pained messages. I'm sure you're seeing too, all these question and answers for people who are struggling at their institutions because they are not getting their ERGs. Even if they do have policies, the policies aren't being enforced. And I also just wanted to say, like, kudos to both of you, because what you guys have set up at the Harvard institutions literally the same thing that in the past 10 months we've had to set up at the AJMAs. At every one of these institutions, you have to fight like hell, be boots on the ground, be organized and replicating what we then also have to do nationally, so that we can have local continuous grassroots continuously pushing for every single point on every point that you eloquently stated. But then to globally and nationally have a larger group who can come in and say, you're really failing the standard, and we know what's going on at these other institutions. This one's doing this, and I do want to say that for so many people who are in the question and answers, and it's paining me to read some of them, most of the institutions do. I will say, I question some. Two of which are being investigated at peril of losing their NIH funding right now from Congress. That would be UCSF and Columbia. But there are still so many people, including at those institutions, Columbia being my alma mater, who do care and do want to make these changes. But again, it's this continuous pressure that has to be put again and again from so many different levels. You guys,
And I really want to talk about this, just capture this moment. About UCSF. So what we've been advised to do by legal is I've just searched it, ucsfhealth.org, about our mission, okay? Values, under pride, D for diversity, understanding and embracing the diverse beliefs, needs and expectations of our patients, community, and employees. And then UCSF Health treats all patients who require our services without regard to race, religion, color, national origin, citizenship, or other protected characteristics. When I put, with Elise or our group of leaders, put our issue together, we pull out the credo of our system and we cut and paste in how is this particular action by this particular person consistent with this line from the credo, which we, like them, sign off on and agree to every single year. Otherwise, we don't maintain our employment here or we don't get paid. So without fail, that has generally come back with some sort of correction to that person. And these are actually really, really simple things. Title VI is very simple. We often connect with our Jewish allies in other organizations to get advice on this. We don't have to make it more complicated than what these hospitals are already stating in their mission statements, in their diversity statements, in their credos. You name it. There's pride on the front. How I would have written something like, how are you proud that this is part of the hospital? This type of statement. How does that fit with the D part of pride? It's not complicated because the hospitals appropriately have set themselves up to the very highest standards of diversity, inclusion, and belonging, totally appropriately, because healthcare knows no political, religious, ethnic, national, you name it, boundaries, gender boundaries, you name it. And that's entirely appropriate for healthcare systems. And that's why you, Elise, Yair, Yael, we find this so, in a way, not confusing, but just so amazing that it could happen in healthcare, because healthcare is supposed to be that golden city on the hill that doesn't do any of these things. And I think it's not a challenge to ring that bell at the highest positions in the hospital. Tell me, how did this help the mission of the hospital that is clearly stated? It's not a little subparagraph of a subparagraph of a subparagraph of mission. It's there in their very carefully constructed pride statement of UCSF that diversity and inclusion of everybody matters in the hospital.
100%. We are nearing on an hour. Yair, there are so many questions, and I am trying to incorporate them and
trying to answer
into
some in
my
there.
question.
Yeah. Someone asked about the definition of anti-Semitism. We keep citing the state-based definition, which is inclusive of anti-Israel.
Could I just say that we feel that that's the strongest thing? It's on the US State Department website. It's on the US anti-Semitism ambassador's website. You know, we didn't make it up. This is our government, an elected democratic government, that has that definition on its website. You know, if that changes, I guess we'd think about changing it. But at the moment, it is governmentally authorized in this country, basically.
So hold on one second. There's so many good questions. And like I said, we have a hard stop at 9:15. Maybe if there's going to be interest, we'll have a second of these sessions. But I want to zoom out a little bit and ask you a question, because several people asked me, called me, or, you know, texted me when they heard about this webinar. And, you know, first I have a question actually for Yael, because I heard about your ERG at, you know, Mass General Brigham. But I want to ask Yael, how, I mean, is this really like mushrooms after the rain? Do we have a lot of ERGs across is it becoming, let's say that I go to my leadership of the enterprise and I say, I want to create a Jewish ERG. Would it help me to say, in the same way that Elise and Mark in Boston, and this in California, and this in Kansas, or whatever, is this spreading out and becoming a trend? And if so, would it be easier for us, everybody who works in different enterprises, healthcare enterprises, to do this? And then the second question that is for all three of you, I have heard people who are literally afraid, meaning, you know, we didn't get the chance to speak yet on how to start an ERG. And I'll give you a hint, is that it's related to starting maybe with a letter to the CEO, the president, maybe the SVP of HR. And some people are afraid that if they will start this process, they may be on the, you know, shit list eventually and can get into trouble. So I guess the question for Yael is this becoming, do you see it in your job as the president and founder of AGMA? Do you see it spread all over? And should we be concerned, each of us, individuals, groups, to reach out to leadership, asking them for a Jewish ERG?
Yes, so 100%. 100% yes to everything that you said. So it absolutely is helpful that Harvard has done this. And I would say that all of the institutions, and Mark was saying, they hold themselves up to this highest standard. And they frankly just don't know what to do. And as we've seen for millennia, but certainly in the past 10 years, there's this huge push to fight hatred. We want to get rid of racism. We want to get rid of these horrible human behaviors, or certainly control them, or put them on the shelf like we did smallpox and polio. But the way to do that is really to study and anti-Semitism is really the millennial old hatred. So this is the one that we should be targeting. So all of the institutions really want to find a path, a role model that they can follow. And really, once one is doing something, and if it's working, all will follow. So absolutely, this is happening in more places. Harvard should be used and quoted. Where else is it?
Yeah, I have to correct you on this. This is Mass General Brigham.
Yes, I'm sorry.
This is hospital.
Just don't worry. Just say it's so confusing. We are all Harvard hospitals. We are not the Harvard Medical School, but everyone in the Mass General system, we're all faculty at Harvard Medical School. It's too nuanced. Say the hospitals at Harvard Medical.
That actually is a question. Then one of the questions that to answer at the difference between medical schools and institutions, which I think we should address too, because that comes up widely. I'll try to answer now.
I did want to just, because there's one really important question about what happens if you get pushback. I mean, there's the two things to what you said, Yael, and it's the President Roosevelt statement about this, fear itself, the thing to fear is fear itself. And that can hold us back from speaking out. But I think to Elisa's point, there are two things that can be done, which I think are useful when you're getting resistance. One is obviously one speaker is less than multiple speakers who are speaking about this. And you want to gather together the most senior group of staff around you from all areas to make the pitch to the institution that you would like to set up a Jewish ERG. And then the other thing, ironically, is perhaps potentially to say, listen, are you open to a call with Mark and Elise? They set up an ERG in at Mass General Brigham in the healthcare system, and that we could talk, you know, because there's sort of an irresistible wanting to, you know, just to speak about something, just so that the hospital administration. And then the third piece of it is just having worked in academia since a relatively young age, I would just say you have to take this to the very top of the institution. And you have to have the courage to do that. And often the most senior staff are willing to do that because they take things to the leadership about the lack of beds for the patients or the lack of this or whatever. And they, you know, they're used to that, bringing important ideas to leadership. And so those are sort of three ways, is to be aware that fear itself is something that you have to fear, that alone, and then that gather your allies within the institution as senior as possible. But Elise and I have run into senior people who didn't want to be involved. We've run into senior people who were vehemently supporters of ours, and we gathered those people together to make these approaches. And then thirdly, take it to the top. That way, just saying this is an important message that we think leadership needs to hear, basically.
I'm trying to answer things in the chat as it goes. So two things. What? Yeah, what?
Oh, I was just going to say, like, for instance, in Boston, in your neighborhood itself, is Tufts was not allowing their doctors to form an ERG, and it went on for months, and they kept going back and kept going back. And you know, I think some of the faculty, when there's so much pushback and so much resistance, people can be nervous about their position. But with time and persistence, and also with outside organizations, you know, raising many of the points that Elise made, it did eventually get moved forward. And to answer where else are there groups, there's a great group at Columbia. There's a very active group formed out of the hell of the experience at UCSF. So they are forming more and more.
Yeah.
Remember, also healthcare systems are competitive, so we can share with each other which ones have it, and you say, well, such and such has it.
Yeah.
I think it is, like, it does apply pressure, and I think the more we communicate to each other and have shared lessons for our leadership, the better. Someone asked about political. They're confused about this. Why do you mean not political? When someone starts talking about genocide, I say that that's not within it, and that's probably that is when I'm referring to political. If someone starts talking about genocide, we're not here to discuss the war or to discuss your impressions of the war. We're here to discuss what it's like being a Jewish employee in the healthcare system. Someone also asked similarly about individuals, you know, Jews who are anti-Zionists. They usually honestly don't come to our work. We're happy to talk to. We try to talk about shared pain, to quote, you know, Deborah, the hostages' parents, Bellen Goldberg. You know, there's in the competition of there are no winners in the competition of pain. And so to say we have a shared experience of pain as Jews, whatever your beliefs are, it's hard. Losses throughout the Middle East are painful. And so we try to meet people where they're at and kind of connect with them on the losses and the shared identity. And it's hard right now to be Jewish. And if people don't want to accept that and they want to push their values and their anti-Zionist beliefs, they're not interested in coming to our work, or they have other outlets for that. That's what we find is most people who come have a sadness about Israel, have connected to lives lost, and are just worried about anti-Semitism. But we really haven't had, after the initial meetings, any disruptions from people who are just not wanting to engage with us, and that's okay. There's a place for everyone in their community. They're not really happy in our community.
I think that the other point that I want to make to this question about if you meet resistance to the formation of the ERG, the other thing is and we would help, and I know you have all these connections too, to the JCRC, Project Shema, ADL, to speak to those institutions, in addition to speaking potentially to other people who run Jewish ERGs out of healthcare systems like us. There are other advisory groups like Project Shema and ADL and so forth, who would talk to the institution about why it's valuable and frankly that it's supportive to the institution's mission to maintain diversity, inclusion, and belonging, and all of those principles for one of those communities that's meant to belong and be included amongst the diversity of individuals that are both treated and treating in those healthcare institutions. And I think we are in a, you probably know this, Yael, is we are in a privileged environment where, as I said, at baseline, inclusion is a fundamental component of healthcare. I mean, you know, without it, it actually is enormously disruptive. And the consequences are that senior management would not want to see that disrupted. And we have to go for that higher ground, I think, in arguing for Jewish ERGs at healthcare institutions. And we're out there, I'm certainly out there to either help directly or suggest allies who could potentially help those who are on this, participating in this Zoom call, who are looking for further assistance, because I think it's a fundamentally good thing for healthcare in the US. Yeah.
Mark, I'll say something that, you know, the conversations that I had with you and also hearing all of you today, to me, it sounds like, yes, there may be resistance like Tufts, but overall, when I'm thinking about everything, it's kind of like a win-win situation, because it's a win for us Jews to get together, to unite, to celebrate our, you know, ethnocultural background and religion. But it's also good because it's kind of, you know, we're sharing the burden with the enterprise. They are like, okay, the enterprise of the healthcare, we created with our Jewish, you know, doctors and healthcare providers, this organization. And I think it's a win-win. We only have 5 minutes. And I wanted to give maybe a sneak peek from you, both of you. So we talked about ERG. I think you convinced most of us that we should all do this, all the institutions. What should be the steps? Like, how do we start? This all is kind of theoretical. What should I do tomorrow morning? I mean, I know the answer because you told me, but what should we be doing tomorrow morning if we want to start this in our enterprise, healthcare enterprise?
I think you have to just look at your healthcare enterprise and see, do they have ERGs and who is in the ERGs, and start to do that work. And that's where this was Mark's idea. I really didn't know about ERGs before. I think a lot of places have them, but they're not very publicized. So I'd start with that. And then someone wrote something about DEI in there. We are under the rubric of DEI, and that could be a place to go if you don't have ERGs and not sure about your setups, but I'd start to do the research and see what's there.
Yeah, I think the other things are, as we discussed, a leadership group, a group of people that come together with a similar mission. I mean, we don't see our mission as sacrosanct that can't be changed or that needs to be transferred to other groups. It's a suggestion for other groups. But, you know, having started other organizations, the mission statement of what you plan to do under the ERG, under these rubrics of community networking, supporting work and cultural, you know, in other words, that you're going to comply with the overall mission of all ERGs. And then what is your mission and the mission was put together by Elise, that unites that leadership group that's going to take that forward to the hospital leadership to make that first step. This is the mission of what we're going to do, because to leadership might be kind of a bit daunting, like, well, what are these Jewish staff going to plan to do?
Right.
And then the other component is to network that by word of mouth with other Jewish like-minded staff. And that's what we did to make sure that we were getting feedback from our own Jewish network into that leadership group as best as we could by organizing listening sessions. And I'm not speaking out of school here, but we were having listening sessions before the Jewish ERG was official in order to begin to position ourselves like, what are the issues in the hospital that a Jewish ERG would be developed. And I don't think there's any prohibition on, community groups organizing themselves, say, hey, we're seeing this. What's this about? What we should do about it? So almost, you can create a proto ERG. We have no prohibition on that type of kind of meetings of people, like-minded people, like we've seen that in other settings, to just work out what the mission is, what the leadership group is, what are the main targets for activity for that Jewish ERG within your particular hospital. Those are sort of core things that you want to go, get done.
I also want to say just a couple pearls it's all voluntary. So, pace yourself. My husband's name is Mark. Sometimes this Mark, I talk to as often as I talk to my husband. But I've met the most wonderful people across the system who I didn't know before, and it's been enriching. There are the other pieces. Some Jews, I found two things. Some Jews are not interested, and that's fine. And so this is still your professional place. So you have to offer to people, but be open if they're not interested. But then there's been a lot of people who I didn't even know were Jewish or were affiliated with Jewish community. So make sure, you balance out that voluntary nature and approaching people. And I think you'll be surprised at who you find and who you learn from, and sometimes who you've been hurt by too. So it's mixed.
Yeah.
Just one thing to point out, which I don't want to gloss over, is the medical school versus the hospital. So one of the roles, I think, of a Jewish ERG is to reach out to your local medical students. They often will have a Jewish medical student group on campus, which sometimes needs the sponsoring of a faculty member. So definitely liaise. And I'm sure I know you guys are doing that because you guys briefly mentioned it. Make sure that you're liaising with the medical students and the residents. The residents have been having a heck of a time fighting with the CIR, the Union for Residents, which is very anti-Israel. So in part of this group, make sure you have a medical student representative and invite them to your events, support them to have events. And there are still so many questions. I'm trying to type an answer.
Elle, and that's probably for another time, but the big submission that emerged from our listening sessions was precisely that: support for the most vulnerable, lowest down in the hierarchy people, whether it's medical students, nursing students, residents, and that's worthy of a separate call, because I'd love to talk to others about what we can do for Jewish residents, Jewish medical students, Jewish nursing students, Jewish PAs, a number of different trainees that have found this extraordinarily difficult time indeed. And that is most definitely worthy of more time, because I think that can be missed as we're working these upper echelons of the hospital, that actually the most vulnerable are the most junior in our system.
So with this, it's 9:15, and I promise that we'll be respectful of everybody's time. But I think there's kind of a consensus, if the four of us are okay with it. I do think that the community of healthcare providers, residents, medical students, doctors, PAs, etc., technicians would benefit from another conversation like this, because you have lived this. I mean, Yael on a national level, and at least in Mark, at least in the last year, you've been really living this, and how to create this, but also what are the outcomes, the challenges. You can guide us through this. So we'll go offline and set up another of these meetings. But in the meantime, I really wanted to thank you all for sharing so openly your experience. And I can see it in all three of you that you really want to share. You want to clone your programs, your success stories across the nation, Canada, everywhere. So it's really remarkable. And toda rabba for all of this and for the time. And thank you everybody for joining us. There will be a recording, and I'll share it on the groups. And we will schedule a second session, because this is as important as it gets. So toda rabba, everybody. Sorry that we haven't gotten to all of the questions, but that's what we have a second. We'll have a second one. And Laila Tov, everybody.
Thank you
Thank
so
you
much.
very much.
Thank you.
Thank you.